Akron that I can't see.
I could have eventually, kind of, stood up and postured myself in a very prideful way. You kind of lose focus. Sometimes you have to step outside of yourself. And how can we go refocus our attention on how we can serve others in this time?
And so I've just been praying, Lord, how do we see the people that really need the most help? The people that need groceries, the people that need encouragement. And so I thought of Kemp.
If there's a way for us to engage or to be involved, man, we want to do that. And I think that we've been transparent in some of the different events and activities that we've done, not only from the platform of Love Akron, but what we've been able to do now in partnership with other organizations.
Don't do anything else today. Just make sure that you
love Akron. Make sure that you love Akron.
Whatever you do today, wherever you go today, just make sure that you love Akron.
And early on, one of the things I said to Coach Kemp was, I'm like, I'm an employee of Love Akron. We're going to do this black and white conversation. Conversation versus collision. I said, Coach, if we're going to do this, and then we're going to get to that point where we're just rocking and singing Kumbaya, I was like, then can I respectfully ask that you count me out? Because one, if this is not a forever challenge or assignment, if this is not something that we're going to do forever, I just don't want to do it. I want to do something that's going to truly make impact. So I think it's important for us to make note of the fact that this is a commitment from Love Akron forever.
Good afternoon, everybody, and welcome to another Love Akron Live. I am your host and moderator for today, Coach Kent Boyd, Executive Director of Love Akron. I'm excited to be with you on today because I think today is going to provide a very challenging topic. So looking forward to it from a perspective of continuing to bring awareness to kind of some of the things that are happening and going on within our community, but to also hopefully present a call to action for the community all at the same time. So we're going to get to that in a minute. First, I just, want to take a moment. Yesterday was the 1-year anniversary of the death of George Floyd. And looking back on a year ago today, there was a lot of different upheavals. There was a lot of different people that were concerned, but also there was almost a sense of people now understanding that racism in our country is real. This is not one of these things that is no longer there, or something that needed to just be gotten over, but it was still alive and well, especially from a systemic perspective. And so if we could just take a moment, just have a moment of silence and also a reflection, just in memorial of George Floyd, we're going to do that right now. Thank you. All right. Well, thank you so much for participating with us in that. I felt like that was important. A friend of mine, Alan Portnoff, he did it with us yesterday, a meeting that we were in. I appreciate his just authenticity and wanted kind of to meet not just us, but also to meet everybody where they were at that time. So taking that moment of silence, I think, is important, but also it's an opportunity to reflect. In June 17th of last year, we here at Love Akron, we made a commitment to engage in the Black-White conversation through our Connection versus Collision platform. And the one thing that we said is that we will never leave the conversation. And I think that we've done a good job of not leaving the conversation, but continuing to engage in the conversation when it comes to race, when it comes to reconciliation, but when it also comes to healing. And what does that look like in our community and amongst us? And so we're only going to continue to do that. Along with that, we're going to look to raise the awareness of some of the other things that are going on in our community that I think have become a byproduct of some of the things that took place a year ago yesterday. Okay, we're going to get into that. But first, I want to bring along my friend, my sister, our ops coordinator here at Love Akron, Lori Porter, because,
Man, we're rarely on at the same time doing this, but man, we kind of got Lori on location today, right? And so we're able to do some of these different type of things. And Lori's just going to kind of update us, first of all, on our spotlight guests, but also the great thing that's coming on Saturday, May 29th. So Lori, you take it away.
Thanks, Coach. Good to see you all out there. Those of you that have joined us via Facebook and those that have joined us via YouTube, want to ask you to be sure to share, to like, and continue to follow Love Akron. Well, I'm excited to be with you all today and to talk about an event that's going to take place this coming Saturday on May 29th. We will be traveling from various parts of the Akron community. At 12 noon to 1 o'clock, we'll be at Grant and Cole Street. 1:30 to 2:30 we'll be at Princeton and Bacto Avenue. And then from 3 o'clock to 4 o'clock, we'll be in my hood, right over there at St. Ashworth Temple Church of God in Christ, doing something that's called Care-a-Van. And so what we'll be doing is we're going to stop at all those different locations. There are going to be some doctors that will be present to talk about and address some of the questions regarding the vaccine, the myths, some of the truths. There will be vaccines will be available to folks who would like to be vaccinated. There's going to be free food and refreshments, other giveaways, and free PPE, things that you can take home with you. We're going to also celebrate essential workers because we know that when we think in terms of first responders, doctors, nurses, hospital staff, paramedics, police, fire, there's been recognition given to them somewhat in a large way, they have been at the forefront helping through this pandemic. But there are folks like the area barber and restaurant owners and that gal that works in the drive-through a Burger King while you're going through getting that whatever that new burger is, the unbelievable, I don't know what it is. It's not even beef. It's plant-based and it's really good. I tried it. But those folks were essential. They had to continue to work. And so on Saturday, we're going to be saying thank you, thank you, thank you in each of those areas, in the Summit Lake area, the Grant and Cole Street area, and on what they called, when I was a little girl, a long time ago, Shabandi Hill. We'll be right there at St. Ashra Temple and bringing doctors. We have a couple of therapists that will be traveling with us. There's some folks, Love Akron, along with the ADM board, and with the help of Summa Health, we're able to certify 15 specialists that will do grief recovery with as many as 80 people over the course of the next few months. And if you want more information about that, you can just go to our website at loveakron.org. But even on Saturday, there will be someone there talking about mental health and talking about the grief recovery method that is a tool. It's not counseling, but it is a tool to help you identify and perhaps alleviate some of the pain that we experience because of the various losses that we have seen in our lives in general, and then especially again in 2020. Well, Dr. Plate from Akron General, or Cleveland Clinic Akron General, is with us today. And so I'm going to ask her if she'll come on and join us here today. God bless you. Good to have you. Hey, and you have a guest with you today. If you would introduce her to our live audience.
I'd love to. This is Dr. Jamisha Ford. Jamisha is one of our rising second-year family medicine residents who is going to join us on Saturday with the big event. So we're excited about that. We have a whole team that is going to be heading out there with us. We're excited to really educate and talk about myths versus facts. I think that's really important, and really try and establish some trust with our community. We think is so important. So we're looking forward to it.
Great, great. Well, tell me this. Now, there are some benefits of getting the vaccine. And here at Love Akron, on these Wednesday lives, we have managed to every week have a doctor come along with us to talk to us about the vaccination. So Dr. Plate, from where you sit, and of course our lovely intern, if you'd like for her to chime in, feel free to do that. You guys will have to kind of scoot back and forth.
Yep, right. We can do that.
Share the screen there.
Yep.
But
Yep.
What are the benefits of getting the vaccine? Because the vaccine itself, it's my understanding, it doesn't necessarily keep you from getting COVID. It does help in a great way. But if you got COVID and you've been vaccinated, it's our belief that it will help us to save lives. Is that true? Talk to us a little bit about that.
No, that's excellent, Lori. I think two of these vaccines are 95% plus effective. That's huge in being protective towards us. And so we think that the benefits are very great. What we do know is if you were to happen to get COVID and you've been vaccinated, the chances that you would be hospitalized or on a ventilator are very, very small. And Dr. Ford is working over in the hospital on a day-to-day basis, sees these patients that we still have folks very much so on the premises. We are still seeing new cases, and we are still seeing cases that are in the ICU. Jamisha, would you agree?
Yeah, I would agree. Absolutely. We actually just diagnosed someone with COVID today. And as she said, there are still people over there hospitalized and even on the ventilator, unsure of the prognosis, if they're ever going to come up off from the ventilator or not.
So we look at the vaccine and its availability. Talk to us about that. I know Saturday, if there are individuals that are interested in being vaccinated, and people are on both sides of the fence. And, we at Love Akron want to make sure that we create this platform and opportunity to educate our community on the pros and the cons so that they can make a good decision for themselves as to whether they will be vaccinated or not. But the availability, there's been a lot of availability. I even saw there was a raffle or something,
right.
$1 million, something. I'm like, wow, I don't know about that. Talk to us about availability.
Availability now is much better than it was a few months ago. We're excited about that. We are going to have it with us at the event. Summit County Health Department has been nice enough to be there with us and be ready to administer the vaccine if folks decide. I know that we met yesterday about this event, Lori, and several folks said there were a lot of folks coming to the event in hopes that they would have access to the vaccine. So we're very excited about that. We think it's very important to have this conversation one-on-one with folks. So we look forward to not only talking to the group about the benefits, but we also look forward to talking one-on-one for folks that might not want to have a big conversation, but might want to approach us one-on-one. So we think that'll be very effective.
Nice. And again, that's this coming Saturday. So the caravan, we're actually going to be in a van, a big bus. and,
right.
And some folks are going to be in the van, some folks will drive, but we'll caravan 12 noon to 1 p.m. Grant and Cole Street, 1:30 to 2:30 will be at the corner of Princeton and Bacto Avenue. And again, we'll conclude on Shabanda Hill from 3 to 4 at St. Ashworth Temple, located at 1086 Vernon Odom Boulevard. What couldn't people expect when getting the vaccine? I've heard a lot of different things that people should do before getting the vaccine and things that they can do after to minimize effects.
Yeah, good question. A lot of folks are hearing a lot of things out there, and we know that if you get some side effects from this, it means your immune system is working. And there are some folks who have gotten it who haven't noticed anything. It doesn't mean their immune system's not working. And so some of us may be a little bit more sensitive than others. And so we know that, being well hydrated before you get this vaccine can be very, very important. And making sure that you are talking to your primary care doc if there are concerns with regards to this vaccine. Jamisha, would you agree?
Yeah, I totally agree. And also just being mindful of other vaccinations that you're getting so that you can just decipher if you do have an adverse reaction or a side effect. So we recommend patients not having a previous vaccine 2 weeks prior to the COVID vaccine.
Yeah, I've heard people say,
oh, go ahead.
No, go ahead.
I would say Dr. Plate hit everything. Yeah.
Great. I've heard people say that if you've had COVID, you don't necessarily need the vaccine.
Okay. So, Jamisha?
So I think previously we thought that if you had COVID, you may build, some immunity against it and not, have the ability to contract it again, but that's not true. We've had patients who have been hospitalized for a second time for repeat COVID infection. So, and then there's the different variants out there. So, and you don't know which variant you had prior to this one. So I would say the COVID vaccine is an absolute, a good idea, even if you have had COVID in the past.
And Lori, we know you have about 90 days. I myself went through COVID. I knew I had 90 days before I would commit to when I was going to get that vaccine. So beyond 90 days, we don't know how much protection one might have if you've had COVID. We like to say, you've got about 3 months and then you really need to decide what you want to do for protection. We know the benefits outweigh the risks. And this is the only way we're going to get a handle on this virus for the future. So we are excited to get the word out.
Excellent. So I'm going to invite Coach Kemp back to the screen with us because as we are committed to educating our community, especially on the hot topics that exist, not just in our city, but around the world. I know today there's some other guests that are on, and their primary conversation is going to focus on mental health. And we know that because of what we've seen in 2020, there are a lot of mental health concerns that have been on the rise as a direct result of just, staying at home. I mean, just being shut in. And it's one thing to be shut in, it's another thing to be isolated. And so isolation causes a whole nother something to happen to folks. And some people are isolated involuntarily because there's no one else for them to socialize with. They don't live with anyone else. And then you take that and you add to that the fear that people have experienced when you consider that almost 1 million people have died. So I want to say to you, I want you to share with us, and Coach Kemp, I'm going to kind of toss that to him so he can segue to our other guests. But what would you say COVID, the effects of COVID have had in the area of mental health as you all have seen it there at Cleveland Clinic Akron General?
Tamisha, you have any thoughts?
Sure. Actually, I just did a rotation at Akron Children's, and we saw that the number of children being admitted for depression, anxiety, suicide attempts have increased. You know, children are doing school from home. They're not around their friends. And then you get to know the other part of the people within your family that you didn't know before. You know, you probably know the 8 p.m. mom, but you don't know the 2 p.m. mom. I would like to lead and say that I don't like the term social distancing because we are physically distancing, but it's 2021 and we have technology, so we can remain engaged with one another, whether it's through text messaging, FaceTime, or even going out in the park and doing a 6 feet apart walk, you know? So I would say leaning, well, you didn't ask me a question of how to address it, but that is what we're seeing on this side. Ways that you can address it. I know me, myself, I'm from Cincinnati, so I'm away from family also during COVID. So with my friends and I, we schedule a happy hour over FaceTime. We schedule group FaceTime calls just weekly. I would say leaning in on technology. We have it at our hands, so why not use it? If we can't physically be together, we can be together over technology.
Absolutely. And Maureen, it's been a huge issue on an outpatient basis as well, as Dr. Ford indicates. Adults that are, even the anxiety of getting back into the office or getting back out there has been huge for people. So not only anxiety over the year, but now the anxiety of, do I wear my mask? Do I not wear my mask? Am I okay to be in there? Am I not okay to be in there? So I can't tell you, I know they're going to really focus on suicide. I've had some very close folks and patients to me that really were victims of COVID as a result of this. So it touches really deep for many of us, and we are treating more than we have ever treated before. Every patient I see, I ask, how are you doing? Because not always will it be evident. It might be evident in their sugar or their blood pressure or their cholesterol, but so important to be thinking along those lines.
That's amazing. Listen, this Saturday, if you're watching out there, Dr. Plate, Dr. Ford, thank you so much for spending time with us today. This has been phenomenal. We need like 2 hours with you, ladies.
We could. Absolutely.
I know. This has been good. So we'll see you all on Saturday again, 12 noon to 1 o'clock. We'll be at Grant and Cole. 1:30 to 2:30 will be at Princeton and Bactel, and then from 3 to 4, St. Ashworth Temple Church of God in Christ, 1086 Vernon Odom Boulevard. There's going to be food. I know that there's some folks that are working on COVID, physical distance, friendly things, even for children. So I say come out if you're in any of those areas. If you're in Akron, period, come out. We want to say to the GAR Foundation, thank you, thank you, thank you. This is not an individual Love Akron effort, but there's Cleveland Clinic, Akron General, there's the GAR Foundation, Summit County ADM Board, South Street Ministries, Summit Lake Building Corporation, Metro, Open M, and Summit Lake, to name the larger folks that are a part of helping this to happen. Love Akron is all about collaboration. Sometimes people are trying to get something done, and Coach Kent will talk to us about folks being in silos. And so we are anti-silo. We are better together. We can get more done when we put all of our dollars and dimes and pennies and our efforts together to do what it is that we're sometimes individually doing. This is a great example of how, because of a grant, a No More COVID grant awarded to many of us through the GAR, that we are afforded the opportunity to collaborate and work together to make our city thrive. So Dr. Plate, Dr. Ford, thank you all so much. I think Coach, I want to bring Coach on because maybe he has one more question for you. Did you have a question, Coach?
No, I do. I was listening to both of them, and I don't know if both of you were able to read the great article that was done probably about a month ago by Doug Livingston from the Akron Beacon Journal, and it was titled "Fighting Demons: Black Men's Deaths Drive Third Year of Increased Suicides in Summit County." And so here's my question: how do we make the increase in suicide rates among Black men a community issue and not just a Black issue?
I think that's a tough question because, this goes beyond just the community. How can we make it a national issue, right? I think if we had the answer to that, I don't have the answer to that, actually. I would say increasing awareness, one, does something. And try to personalize it when you're talking to people. Try to have people stand within the shoes of the people who are affected by it, to see if they can show some kind of connectedness.
Hey, Coach, I would also say one of the things that we've done well through Cleveland Clinic has been our men's health fair. You know, making this part of that men's health fair. The more we talk about it, the more that folks may want to talk about it on the other side, because we are absolutely seeing it. Educating our doctors, reminding our docs, just like we did with women and heart disease, reminding our docs to ask the question. But I think if we can really include it in our men's health fair that we do each year, that could also be very powerful.
And getting people to the men's health fair, right? It's not helpful if we don't have anybody at this fair.
Like folks like this.
Yeah, exactly. Yeah.
Absolutely. Thank you both so much for your time, for your candidness today and your answers, but also how you are loving Akron through the platform that you're doing at Cleveland Clinic Akron General. Thank you both so much for being with us today, and we're excited to see you somewhere down the road in this journey. Thank you.
Thanks for having us.
Thanks for what you do.
Yes, appreciate you. Well, hey, that's going to be kind of leading us into a very tough discussion that we want to talk about today, that there is a rise, if you will, in suicide rate among Black men, but also there's a suicide rise among men and people in general. And it's kind of been that way, and it's been increasing. And so I want to just, I want to caution our audience that we are going to be talking about suicide today, and it may trigger some things in you individually. So I want to apologize for that right now. And this is not a thing for that we're trying to send a negative or a bad message. But again, we want to help to raise the awareness of how things that we've went through in the past in 2020 is leading to some of the deaths that we're seeing moving on. So there's a ripple effect, if you will, from the death of George Floyd that happened back last year, May 25th, 2020, to even going throughout the time now. So I want to bring on my first guest, Doug Livingston, who is a reporter at the Akron Beacon Journal, who he reached out to me about a month and a half ago. And, he said, hey, Kim, I'm looking to do this article, and he's beginning to educate me as far as the suicide rate in the African-American community and how it's been on the rise, and how last year it's probably been as high as it's been. And so, Doug, thank you so much for being with us today, man. I know you're on vacation, so I'm even more appreciative of you being on with us. But I thought it was important, Doug, if we're going to have this conversation, to kind of bring you on, because I think that you've helped to spark this discussion in a deeper manner. And so I just want to read again just the title of the article that you wrote: Fighting Demons, Black Men's Death Drive, Third Year of Increased Suicides in Summit County. Here's my first question, Doug. Why did you choose to do this article?
I had heard that the ADM board was picking up on an uptick in suicide rates among Black people in Summit County. And that was about halfway through 2020. And we were keeping an eye on that and some other trends, obviously with the pandemic, isolation, economic angst, people being the breadwinners to waiting for an unemployment check. It was a very unsettling time. So we looked for some of the issues that people were experiencing prior to the pandemic, maybe being exaggerated. So this is one of the trends that we were keeping an eye on. And then Akron City Councilwoman Tara Samples brought in a resolution to raise awareness of an uptick in Black suicides. And so I thought, I've really got to get a handle of this. I've got to figure out what's going on. And I quickly found that a lot of people don't talk about it. And I think if anybody takes anything away from this conversation today, is this is not something that will ever go away by not talking about it. And so I got a hold of the coroner, the medical examiner for Summit County, and they provided the numbers on everybody that's died by suicide in the past decade. And I got the names of the 12 Black people who died in 2020, which includes 11 adult men and one 15-year-old girl. It was very hard to get a hold of the people, the surviving family members. A lot of messages and Facebook messages and voicemails and direct messages on Twitter. They just weren't returned. And I understand how it can be re-traumatizing for people to talk about the loss of a family member. And it can be really triggering for anybody, especially because experts do say that, suicide is sometimes in the family history. There may be other people in your family, an uncle, an aunt, a grandfather, a mother, father, that may have died by suicide or came pretty close to dying by suicide. So I did talk to a few people, some surviving family members, some that wanted to go on the record, some that didn't. I quickly found out that the reasons why somebody had died by suicide, there is no one reason. Quickly found that this is a variety of reasons, and sometimes there are multiple issues at play. It could be, the loss of income, compounded by mental illness, compounded by addiction, compounded by self-medication, or a mixture of any of these things. But what I was focusing in on is what the Summit County Suicide Prevention Coalition, the ADM board, was looking at, which was the uptick in Black suicides. And when I got the statistics and I looked at the data, I realized that the last 4 years have been really rough on the Black community when it comes to suicide. There has been 36 suicides in the Black community in Summit County in the past 4 years. So that's 2017 to 2020. That's more than in the previous 9 years. So you've had more suicides in 4 years than you had in the 9 years before it. So something was going on, and something is going on. And it's been going on since before the pandemic and since before George Floyd. Now, one of the people I did talk to for the story died by suicide 2 days after the George Floyd killing. And he was glued to the TV, as many of us were, watching that news unfold and watching, the nearly 10 minutes that George Floyd was struggling to breathe. He was watching that over and over again on the news, and his girlfriend of 16 years told me that had a really heavy toll on him. As Coach, you told me it had a heavy toll on a lot of people you've talked to and mentored in the Black community. So whatever is going on, I think the pandemic kind of has exaggerated it, underscored it. But the rise in suicides in the Black community is something that the statistics have pointed to since 2017.
Wow. This is so profound. And let me ask you this, because I do want to bring on my next guest. Tony Ingram, he's the Chief Probation Officer at Akron Municipal Court Probation Department. And so we've had this conversation and he's talked about the uptick as well, right? He's talked about the uptick that has happened. But man, I didn't realize that it's been 36 the past 4 years. That's even more than the previous 9 years. And so let me ask you this, Doug. What shifted in your own perception, if any, right, as you began to do your research about this story? Like what was something that was kind of like that aha or that light bulb moment that clicked on and said, okay, man, this is a little bit deeper than what we anticipated? Because you just mentioned us not talking about it doesn't alleviate it, right? And so what was kind of that moment for you as you did your research for this article? But also, man, what is that some of the takeaways that you learned from it?
Well, with anything, I have this skepticism as a reporter. I want to know if something that I hear is actually true. And the first thing I did is try to look at the statistics for Ohio, the nation, and Summit County. And I realized that the suicide rate per capita among the white population is higher, and it's still higher than it is among the Black population. So I wonder what was going on and why historically have suicides hit the white population harder. And this is one of the reasons why I wanted to call and talk to you. And I'm glad you were able to contribute to the article and the work you're doing through Love Akron and helping get some grief counselors out there and help people deal with the stress they're dealing with. But I wanted to understand why the Black community didn't show up in the statistic of suicide when they're overrepresented in so many other statistics that would underline, that would feed into suicide, whether that be poverty or unemployment or any host of issues that the community may be facing. And I hate to generalize, but that's why I was so glad to talk to you for the article, because I did want to understand how and I never can understand it. So hearing from you how Black people, especially Black men, because 11 of these 12 deaths in 2020 were Black men, how they internalize and how they cope and how they push down their feelings, and instead of processing and working through. And so I think that was a light bulb moment for me, understanding that this is something that's deeper than 1 year of record deaths. I think it's an ongoing issue, and I think it goes back to awareness and talking about it. And I say the other revelation that I realized is just how sensitive the subject is. I spoke with Andrea Denton, who has led grief counseling. They're almost like group counseling for people who have a family member who died by suicide. She's been doing that for 30 years. And I wanted to know from her, what is the best way to talk to somebody who may be exhibiting signs of potential suicide, or somebody who has a family member who died by suicide. And it's a delicate and sensitive topic, as we all know. And you can't just approach somebody in a way that you're not accusing them of having a thought of suicide, but it's their right to think about suicide, and you can't approach them in a way that perpetuates that stigma. So if you approach them and say, "You're not thinking about suicide, are you?" Automatically their response is, "Well, if I say yes, this person obviously is thinking that my thought is wrong. I'm not allowed to have that thought." So I realize that just in the ways that we talk about this, talking about it is great. Don't be afraid to talk about it. Educate yourself on it. Learn as much as you can, so that when you are that person that's in that position to listen and engage somebody and make a difference, that you're comfortable doing that, and you do it in a way that's most effective.
Man, thank you so much for that, Doug. I want to bring on Tony. Here's the thing. I'm going to just follow Doug's lead here, and we're just going to talk about it today. So we have a great guest on with us. We have Tony Ingram. I also want to bring on Michael Montgomery, who is a therapist, and he's an independent marriage and family counselor. And I also want to bring on a brother that's turned into a good friend of mine, Tony Coder, who is the executive director of Ohio Suicide Prevention Foundation. And so we're going to have just an open and honest and really just candid conversation when we talk about, suicide and how it's really become this underlining thing that is going on and happening that I almost speak for myself. I wasn't aware of it until Doug called me, interviewed me, and then I read the article and I was like, wow, are we doing enough, right? And so, Tony, I'm going to give you, Brother Ingram, I'm going to go to you first. Now, Doug just said we've had more suicides in the African community the past 4 years, which is 36, which is more than we've had the previous 9 years. What do you say to that, sir?
I say we are on the cusp of a real crisis and a real epidemic amongst Black males, not just in this community, but nationally as well. Much of what we're seeing here is true nationally. Excuse me for the puppy, but
sorry.
National Black Caucus had started a coalition to address this issue on a national level. And I agree with Doug. Something is absolutely going on. And it behooves us now to begin to focus on it. And I agree, not just talk about it, but we've got to do something and begin to engage a group that I belong to that doesn't traditionally engage in the type of services to help alleviate some of the pain associated with trauma, as well as resulting in much of what we see around suicide. But before we move on, I just want to make this point. And Kemp, you said if anyone's triggered by the conversation we're having, and it's going to be a deep conversation, there are some immediate resources that we can have folks call into. The National Suicide Prevention Lifeline is 1-800-273-8255. Again, it's 1-800-273-8255. 8255. Locally, our ADM board has a suicide prevention call-in line as well, and that's 330-376-9494 and extension 211. You'll have the ability to talk to someone directly to get you in contact with the appropriate services that you need. So please reach out if anyone is out there struggling. If there's any question in your mind that you're contemplating ending your life, there is help. There are people out there who care. Obviously, the folks who are here today are here because out of love for this community and for you as well. So please reach out.
Man, Tony, thank you so much for that vital information. I'm gonna go to my guy, Tony Coder. We engaged probably about a month ago where we were connected through an email through a mutual friend. And Tony, this has been on your heartbeat as well as far as the rise of suicide within the African American community, in particular with African American men. And from our first conversation, you kind of had a call to action. Could you let our audience know what that call to action is from the seat that you sit in?
Yeah, one of the things is, everybody makes a statement. We all have statements about everything, but statements without action to me are kind of useless. So, one of the things that we did immediately was we engaged a marketing firm and just created a Life is Better With You Here campaign, which can be found at withyouhere.org. It was something, it was kind of disturbing as we started looking at this, the lack of resources for African Americans, especially African American men that are out there around mental health and suicide. And we knew we had to do something about it. So we took action, started it, and I'm actually so grateful that you and I have been connected and that we're going to continue our work together.
Absolutely. And that kind of goes back to, COVID, all the things that happened last year has kind of been known as the great revealer, right? It's revealed just what you just said, Tony, about, some of the disparities, if you will, that are happening that are not in the Black community, but also that Black men don't have access to. And so, Michael, you're kind of an enigma, if you will, right? You're an African-American male, and you're also a therapist. It's like, whoa, hold up, because why? There's so much stigma that is associated with mental health. Tell us, Michael, what you're seeing as it comes to an African-American man and really receiving the type of help that they need as you sit in the seat that you sit in. And what is some of the things that you talk through that you look for? Doug said this before, is like having the conversation about suicide. Can you elaborate a little bit more on that with us, Michael? How do you do that as a professional, and what does that look like from your seat?
Okay, Kim, thank you for having me. In the essence of time, can I just go back to that and it was a very important question you asked Dr. Plate. Do you remember what it was? And they had difficulties answering it. Can you ask that question? I just want to take a stab at it. I don't have the answer, but I think I have something that might help, if you don't mind asking it.
No problem. Here, let me tell all the viewers this. I don't think we're going to get done today at 2:30. So I'm okay with that. That's not a problem. But here was the question, Michael. How do we make the increase in suicide rates among Black men a community issue and not just the Black issue?
And I believe how we can do it, we have to show the correlation between Black males who commit suicide and the impact it has on their families and others who are attached, specifically young Black males who now have lost an uncle, a dad, a cousin, and now they don't know how to process that trauma. So trauma sometimes get processed through anger, resentment, bitterness. Now they're going out in their community and they start committing some very, terrible acts. And these acts land them with Tony in the juvenile justice system. And we know sometimes the juvenile justice system, as great as it is, it doesn't rehabilitate them, but it makes them more prone to go to the next level, which is the prison system. Now the prison system, now we gotta care for them, our tax dollars, and we know that it's cheaper to prevent than to care for a prisoner in the prison system. So that's how we make it relevant to the masses. And I had a boss who said it's WIIFM, Michael. What's in it for me? What's in it for us as a whole? Why we should do this to help Black males stop killing themselves. And Doug Livingston, thank you for that piece in Akron Beacon Journal. And I think you were saying that you didn't know why it wasn't getting, like national prominence or whatever. You know, Ice Cube played a character in a movie called Boys in the Hood. The name of that character was named Doughboy. He had just lost his brother Ricky. And the next day, he said, man, I'm watching the news. And he said, either they don't know, don't show, or don't care what goes on in the hood. And that's why it's not national prominence. But what I see, you can't talk to African-American males about suicide because that goes against our nature, which is we're God-fearing. So we have to ask them, do you ever think about what life will be like without you around? Oh, yeah, I thought about that. You ever thought, man, sometimes how, man, we not even relevant, man. Don't nobody even care about us around here, man. We invisible. Yeah, man, I think about that a lot. Those are suicide ideation, but they don't want to put that label on it. I was telling the guys the other day, in some cultures, the Somali cultures, they don't even have a word for suicide. They don't even have a word for depression. The Native American brothers and sisters don't talk about depression. They talk about the spirit of sadness. So we have to talk to them in their language to reach them to say that this is all the same thing, which is depression, anxiety, which leads to some cases suicide. Long answer, but this is so important to me. So thank you, Kemp.
No, man, thank you for your answer. And that's going to lead me to my next question. And Doug kind of asked this before, right? So the uptick has happened. We know that. We know the stats. Tony, you were talking yesterday about how, you know, the rate is 40% higher than our white brothers and sisters, right? And so my question to you, Tony, and also to the group, what has changed over the past few decades or even few years for that uptick to happen? Doug just talked about how, man, we've had 36 suicides over the past 4 years, which is so different. So what's changed? What's happened?
I think Doug pointed out quite frankly, a relevant time frame. And over the past 4 years, there has been sort of this awakening, and we have seen, and I'll just be transparent. I think many of us feel even more traumatized. We are feeling more isolated. We are feeling less a part of this great experiment called the United States, and are no longer or less relevant even than we were before. It had oftentimes, and I'll just be frank, over the last 4 years, there just seemed to be a direct attack on Black men in terms of whether it be voting rights or whether it be incarceration. In my field, we talk about making changes to the criminal justice system because we know the results that have happened from the criminal justice system. We continue and have continued to remove Black men from society at an alarming rate. And having done that, not understanding and not thinking what impact that is going to have on Black families and on the Black community. And I just think over the last 4 years, there were just some things that were happening at a national level that a lot of folks were just losing hope that things were moving in the right direction.
Wow. From your perspective, Tony Kohler, what's changed? Why has it been an uptick? Just from the seat that you sit in, what have you seen that has changed?
I mean, if we're going to be honest, and here we go, the political environment. I mean, never have I seen in the last 4 years, quite frankly, that we have given so much voice to folks who want to keep others down. And I don't care what side of the aisle you're on, but if we aren't if we aren't trying to live together, your point of or your question of why it is it impacts the entire community, because we're all Americans. That we work together, we serve together, we go to church together. There's no matter what happens. If it happens in the Black community, it impacts the entire community, because we are supposed to, love Akron. You don't say love Black Akron, love white Akron. You say love Akron, because that is what you are all about. Is Akron is a community, and if one part of that community is hurting, then the entire community hurts.
Man, Tony, you get me fired up over here, man. Get me fired up. And I see Doug's mind moving. There's going to be a part 2 to this article that's going to come out. I already kind of see that his mind is moving. And Doug, please feel free to chime in here, man. Like, just some of the things that you're hearing, feel free to chime into some of these questions. You're a part of this too, man. You're the one that kind of got us all here to the table when you wrote the article.
Sure. I've got to check in with Dr. Doug Smith again at the ADM board and see where the trend is at. I know 2021 and the first 3 months was on pace to hit that same high level that we hit in 2020 for the Black community. So hopefully that trend has stalled or abated or reversed, but I've got to check in. There will be follow-ups. The only other thing that I did want to point out in statistics, and I'll leave it to everybody else here on the call to address, it was the method used. That in 2020, among the 12 deaths in the Black community, 8 of them were by gun. And that was significantly higher than among white people who died by suicide. So you have, in any year, among everybody who dies by suicide, a little more than 50% is done by a gun. But in the Black community, in the Black numbers, you have closer to 67%, closer to 2/3 by gun. So we've talked about the unwillingness to get counseling or to talk. The stigma maybe a little stronger among Black adult men, but also the prevalence of firearm as a number one method for suicide.
Wow. Michael, what do you make of that? What do you make of that statistic?
Well, Doug is making the correlation, and we're all doing we're not saying that it is, but the correlation is there's a lot of guns out there on the street to make it more accessible. The first thing we assess when someone comes in who has depression, we go over, their plan, well, how would you do it? And then they say, well, I would take pills, or I would do this, or I would do it. Well, do you have any pills at home? Yeah. So if I'm talking to an African-American male, and he say, well, you know me, I'm going to get my 9, or you have a 9, so all that is interrelated. There's a lot of guns on the streets. And, in the hands of someone who is troubled, someone who doesn't see that there is hope for him. Tony spoke about it. I don't have a steak. I don't get a slice of the pie. Tony Coder, I want to say, if everybody thought like you, what a world and what a country we'll have. Unfortunately, Tony, there's many people that don't see it, that Black problems impact white people. So we're not gonna, necessarily drill down on that, because, if I was in another arena and I wasn't on this, I would say what people really say. That's just them, and those Black people on here that know what I'm talking about. We'll replace that word with something else. That just ends killing ends. What do we care about that? Less ends to deal with. And I'm just being real about it. So this suicide really, we need to bring more awareness, but we need to educate everyone, like you just said, Tony, that this is going to impact your community. Back in the day, I grew up in Tampa. Crack cocaine started in the 80s, and nobody thought it was a big deal. It's just a Black people drug. But as soon as it hit, our suburbs, then we created a war on drugs. That's what I'm saying. It's coming to your town. Just hold on. So We have to sound that alarm, and we have to be more inclusive in sitting at the table of these health disparities, including mental health. And there is a big stigma, and it's still a taboo. African Americans lag behind in seeking help because we've been raised to get on our knees and pray more. And I pray every day. But the scripture clearly says faith without works is dead. So we have to be real honest with ourselves and bring more awareness to this starting to become, it really is an epidemic. It is. And Doug, I'm sad to say that I think those statistics are lower because there's a lot of people taking drugs who are slowly killing themselves every day, but it gets reported that they died of an overdose. I'm here to tell you because I worked in a male treatment facility. Those men are just slowly killing themselves. So it's higher. It really is.
It kind of goes back to that question, which came first, the chicken or the egg, right?
Right.
Was it the mental health or the physical that came first? Which one happened first? Was it the addiction or the mental illness? And so those are things that we don't know. I want to just, man, go around each one of you, man, before we got to go and cut off, and I'll give mine at the end. But just give me one call to action. If you have one call to action that you can give out to us today as a community, because again, I'm gonna piggyback on this. This is not just a black man issue, right, or a black issue, but man, this is a community issue. Because I love that the ripple effects are going to go out, and it's going to affect the community. It's going to affect the home. Michael spoke about the home. He spoke about marriages, right? And so, what's one call to action? I'm going to go with you first, Tony Coder. What's one call to action that you would give people right now?
Talk about it and don't be scared of the issue. The more we can talk about it, I remember when I was a little kid, my grandma would always say, if somebody had cancer, it'd always be like, oh, she's got the C word. She's got the C word. And that's what we called it. And now, there's breast cancer walks, and people are celebrated for overcoming, cancer. We have to be the same with mental health. We've got to talk about it and then celebrate recovery. Talk to folks like Michael. Michael got to meet him the other night. Not only is he a good-looking guy on film on the thing here, he's also fantastic to talk to, and just will be able to help you out. So I think talk about it and don't be scared of the subject.
Go ahead, Michael. Your call to action.
Tony stole my thunder. He really did. He called me before this and said if this question comes up, he hoped to go first. That's exactly what we need to do. We need to raise more awareness about it. Make it, like I said before, when the smoking rate went up with teenagers, they really did targeted marketing to say, hey, we need to talk about this. And they came up with some catchy slogan with young people. I think young people need to lead the charge on this, get them educated, get them able to go out and speak about it, talk to their friends, because peer pressure has more impact than what we can do. And then also the pastors. The Black church still is the #1 meeting place for African Americans. Talk to the pastors. And I know it's difficult to have, but just let the pastors know that this is going on. And it's not an attack of the spirit, it's an attack of the emotion. So get that out, talk to them more about it, and let's spread the word that this is happening, and we want it to stop immediately. Thank you for having me, Kemp.
No problem at all. Tony Ingram, your call to action.
My call to action is that we continue to have forums like this, and that we're mindful of doing so. And that people like all of us here share our story and our perspective so that we can make this problem real. The changes that have occurred in mental health since I started my career 30 years ago have been tremendous. We now talk about mental illness in terms of recovery. That's not what we talked about when I first started. So part of that ongoing conversation talking to people who are truly suffering, hearing their story, beginning to understand their pain, and beginning to let them know that there is a better alternative, I think can go a long way. And having this forum, folks like you, Kent, who are in leadership positions, Michael as professionals, myself in leadership positions, can share the stories and the trauma and the pain that we go through on a daily basis, and bring some real life to this issue. So that's my call to action, that we continue to gather, we continue to discuss, and we continue to work on solving the problem, not just talk about it.
Doug, last but not least.
So yeah, awareness is, I mean, it's huge. There's 2 to 3 times more people who die of suicide than traffic accidents or homicides. But you turn on the news and what do you see? Fatal traffic accidents and homicides. So there's a perception out there that suicides don't happen. They do. And I think if there was a campaign like we saw for breaking the silence on opioid addiction, then we would start to turn the tide on these suicides that they've been stubborn for decades. And I guess while we wait for that public level of engagement and awareness to get there to the point where there's some systemic change, some help coming, I think personally we can help each other, and we have to. So if you have a loved one or a coworker, a friend, they gain a lot of weight or lose a lot of weight, they start missing work, you see something off, you're the person in a place where you can ask them, hey, how are you doing? What's going on? How are you feeling? What are you thinking about? You're the person that they may trust when they don't trust anyone else. So I guess just be aware of who you're around and take care of each other.
Absolutely. And Tony, I know that you're aware of this because I know you all are doing it down in Columbus. We're doing it here in Akron at Love Akron, where we are helping to train people in mental health first aid. And a part of mental health first aid is asking the question, are you considering harming or killing yourself? There's actually a segment of the training where we teach people how to ask the question. And then if they say yes, there's a progression. And Michael, you mentioned this earlier, that we take them through to say, hey, have you started to plan this? What weapon are you thinking? How are you planning to do this or execute this? So it's a really challenging discussion during training. But at the same time, if you're in that position, you know how to handle and apply the tools and the techniques that you need to, that really might save someone's life. Because from there, you want to triage them to a professional like a Tony or like a Michael, so they can get the help they need. So anybody that is interested in mental health first aid training for you or for your organization, all you have to do is go to Love Akron, www.loveakron.org, and we can get you signed up and get you trained. We do this in a partnership with our partners at Red Oak Behavioral Health. And so I know, Tony, you're an advocate of that. I know that's something that you all do. But also, Tony, tell us again about the campaign, Life is Better With You Here. Where can we get more information about that?
Go to the website, withyouhere.org. One of the things that we're really excited about, that we just created a partnership with from a group called Black Girl Smile down in Atlanta, Georgia, is that they're offering any young African-American girl, I think between the ages of 12 and 22 even, 6 months of free therapy. They'll pay for it, therapists in your area. So, there are tools and resources, how to have the conversation, how to persuade them to get help, and then get them referred to professionals like Michael and other therapists in the community. So look that up, withyouhere.org.
Man, thank you so much for that. And Joe, my production guy behind the scenes, he'll get that up in the chat, withyouhere.org. Man, gentlemen, thank you so much for your time today, for your candor, for your honesty, to really talk about what is a very difficult conversation. But just because it's difficult doesn't mean that we don't need to have it. So thank you all for your time today. We look forward to seeing you down the road again on this journey that we're on. And just thank you for your time. We appreciate you.
Thank you.
Thank you.
Thank you.
Thank you for your leadership, Kent.
So again, my call to action is simple.
and it's right behind me. We have to continue to listen, to learn, so that we can lead together. And when we listen, man, it's listening to understand. It's not listening to try to find out the right and the wrong all the time. That's become a barrier for us, and that's become a stumbling block because we're getting too caught up in what's right and what's wrong. When we have to start saying, hey, man, we're just different. And these differences happen because of this reason, but it doesn't mean that you're right. That doesn't mean that you're right and I'm wrong, or that I'm right and you're wrong. We have to be able to listen to one another to understand. And when we can do that, we learn more about one another. It don't mean we always agree, but we're learning more about each other. And so we want to stay in that vein as much as we can. And again, this is Mental Health Awareness Month, and we have initiatives that we're doing here at Love Akron when we talk about mental health and wellness. One of I've already mentioned with is mental health first aid training. We have a bench of trained instructors that will come and train you, your organization, because this is so important right now within our community. COVID has been the great revealer of things, and what it has revealed is that there's people that are feeling isolated, they're feeling withdrawn. You heard Dr. Plate mention earlier, now the transition of going back to work is playing on people's minds as well. So here's the responsibility of lay people like myself. Is I'm not a professional therapist. I'm not like Michael. I'm not like Tony. I'm not a professional therapist. But here's the thing. If I can become aware of the signs and the symptoms of a mental health disorder, then guess what I become? I become a more informed person in the community that can help somebody get the service and the help that they need. And the Adam Board does this really well when we talk about Change Direction. Change Direction is a national program that describes the 5 signs of suffering and how to know where people are at, so that we can triage them to get them the help that they want. And so again, if you are looking for mental health first aid training, you can go to our website at www.loveakron.org. If you scroll to the bottom of the first page, all you had to do is fill out a little card, and it'll go directly to my email and also to my assistant's email, and we'll reach back out to you because we would love to get more people trained in mental health first aid. When more people get trained in mental health first aid, this is what happens. We increase awareness, but also we reduce the stigma that is associated with a mental health disorder. Something else that we're doing is called the grief recovery method. We have right now 15 trained specialists right here in Akron that is looking to help to take people through the process of grief. And when we talk about grief, it's just not the loss of a loved one, but it's the loss of any hope, dream, or expectation. And 2020 led a lot of people to lose hope, to lose out or miss out on dreams and also expectation. So again, please visit our website, go to our mental health and wellness initiatives. And man, there's a way that you can get involved. And we also have a card. If you're interested in grief services, go again to the front page of our website, fill out a card for the grief recovery method. And again, we'll be in touch with you to help you to go through the grieving process and to come out on the other end better than what you was. We have to stop suppressing how we feel, people. We have to stop doing that. We got to start leaning into it and look to overcome some of these things. Again, thank you so much for being with us on another Love Akron Live. This is what we do. We want to help to engage you and to have these encounters so that we're all listening, learning, so that we can lead together. And let's remember this one thing. If we don't do anything else, just make sure that you love Akron. Be blessed, everyone. We'll see you next time.